Okay, we will be starting now. If you are still eating, keep enjoying the meal. Um, my name is David Parra, and I work for AARP. And even though the work that AARP does in Arizona covers pretty much the whole state, my role for AARP in Arizona is to reach out to the Hispanic Latino population. And back in 2017, we launched a platform called AARP Arizona Hispanic Connection. And that comprises a radio show. We do have a Tuesday Spanish show and a Thursday English show. We're trying to serve both the Spanish prefer and the English prefer audiences. And the radio show is Facebook Live. So in addition to the radio show, we also have a Facebook page. On the table, you should see a flyer like this. I'm going to strongly recommend, and not recommend, ask you if you wouldn't mind taking a flyer and following our page and sharing the page, recommending it to others. So this is back in 2017. By 2018, we added to this platform something called Lunch and Learns. And I don't know how many of you are familiar with TED Talks. Raise your hand if you are. Oh, most of you. That's awesome. Well, believe it or not, that's where my idea came from. I said, you know what? AARP needs to have this TED Talks, quote unquote. And I look for names. I wanted to call them Si Se Puede Talks, because I wanted to link it to Hispanics. And I really like that, Si Se Puede Talks. But when you're dealing with names, you enter into the realm of technicalities and rules and laws. And I said, oh, it's too complicated. So eventually, we just made it part of the AARP Arizona Hispanic Connection platform. So as part of our efforts to reach the Hispanic Latino American, we have this platform again, AARP Arizona Hispanic Connection, with radio shows, Facebook Lives, and then we added the Lunch and Learns. And before I get to the Lunch and Learn in Tucson, we also have painting events. So consider this first Lunch and Learn as a seed, S-E-E-D, a seed is the first. Then I reached out to Maria, who is going to be sharing in just a bit, Maria Ramirez Trillo. She is an Associate State Director with AARP, and she serves the Tucson area. And then we reached Marty Cortez, who is a member of the Executive Council for AARP Arizona, and Rosie Garcia, a volunteer, and then Jim Garcia. You also Garcia, ¿verdad? So, and Jim works with the Hispanic alumni of the U of A. And so we started to kind of say, oh, you know what, I need your help. I would love to start offering TED Talks, the AARP Lunch and Learns in Tucson. So this is how this started. So first of all, I want to welcome you, and I want to thank you for coming. It is the first one. This event is being videotaped, so it's going to become a video, and we're going to post it where? On Facebook. What page? AARP Arizona Hispanic Connection. So this is what this is all about. And how many of you are here because you received an email from AARP inviting you to come to this event? Thank you. And then the rest of you heard through us, right? Through what we would call more direct person-to-person invitation. I understand that yesterday we had over 180 folks come to the Movies for Grown-Up event, and they distribute the flyers. And then, Maria, you went to the El Pueblo Neighborhood Center to invite folks. So, again, consider this the first. Consider this a seed, because we will build it. And what is the saying? What is that slogan says? If you build it, they will come. So we in Phoenix, We have managed to raise the number of attendees to 100. So that's kind of like our goal, to reach 100. But when I talk to the folks here that are locals, is David, stop dreaming, let's start with 50. So we kind of set the goal to have 50 folks here. So here again, welcome. This is AARP Arizona Hispanic Connections first Lunch and Learn in Tucson, Arizona. So the agenda that we have today is very simple. You should have seen it. I am already doing the welcome and introductions. We're going to have Maria Ramirez Trillo speak to you about AARP in Arizona and in Tucson. Then we're going to have three speakers who is going to be the meat, if you will, the meat of this Lunch and Learn. We are going to talk about healthcare, stop RX greed. This is a very important subject. I'll say a little bit more when I introduce the speakers in just a bit. We'll have three speakers on that subject. And then Marty Cortez is going to help us to do a little survey for future Lunch and Learns to get your input so that we can make this better. We are scheduled to be here no later than 1:30. I always try to end earlier, so hopefully we'll manage to do it. I know some of you might have to go back to work or what have you. So let me now introduce my colleague, Maria Ramirez Trillo, who will address AARP in Arizona and in Tucson.
So, AARP was founded on a very simple premise that no one should live in poverty and in a chicken coop. And we say that because our founder, Dr. Ethel Percy Andrews, found a very distinguished retired teacher living in a chicken coop. And when she found that, she made it her life goal to then help retired teachers and people of all ages to live better. And so Dr. Andrews then went around and tried to get an insurance company to give retired teachers group insurance. She established the National Retired Teachers Association in 1947. And she was able to convince one insurance company to provide that insurance service. But then she had people coming up to her and saying, I'm not a retired teacher, but I need health insurance. And this was before Medicare. So people really were hurting for health insurance. And so then Dr. Andrews decided to establish AARP in 1957. And she was 76 when she did this, and I think that's just amazing that this woman was able to do all this in her lifetime. So today, AARP continues to advocate on behalf of persons over 55 on issues that are important and that matter, such as health, financial security, livable communities. All of you are aware, if you're an AARP member, you're going to get the AARP magazine and bulletin, but a lot of people aren't aware of our programs. And I'm going to mention a few of those. We just finished our AARP Tax Aid program, a wonderful program that helps people, anyone really, that is low to moderate income, getting free income tax services. Here in Tucson, we're lucky to have AARP Tax Aid program, plus the United Way VITA program that also provides free taxes. I can tell you that at our office, we saw over, just in our little office, we saw over 750 people that came during tax season. Two interesting stories about that. This tax season, we had 3 generations show up on the same day for their taxes, the grandmother, the mother, and the daughter. They all came together to do their taxes, which was pretty neat. We also see a lot of widows, first-time widows that now have to face doing their taxes alone. So our volunteers, our tax aid volunteers, are very compassionate. They're going to be there to do that widow's taxes, but also, listen, and they hear and see the tears because it's a tough time. So we see a lot of great work done in the tax aid program. We have a smart driver program, and I recommend this to everybody because when was the last time you reviewed the driving rules? Believe me, if you take this course, it's an eye-opener because it's a 4-hour classroom course, or you can do it online. But it reviews and refreshes your driving skills. So kind of important for all of us if you think about it. We have a fraud watch network. Yes. It is online also, the driver safety. Yes, that's one of the benefits. Depending on your insurance, once you take this 4-hour class online or in classroom style, you will get a certificate. And so you can take that to your insurance company and get a discount. But it does depend on your insurance company. We have Fraud Watch Network, which is also an initiative that we want to make sure there's a lot of education on fraud prevention, ID theft. There are scammers out there that are extremely smart and that want to go after not only our seniors, but right now veterans. So we have a lot of educational materials that we want to provide you or anybody in the community that talks about that. A very special program for us, Back to Work 50 Plus. We have a partner in our community that I want to recognize today, Pima Community College. We have 2 staff from there. And Pima Community College has a grant from AARP Foundation. And this Back to Work 50 Plus program then is going to help anyone that's looking for employment that's over 50. And they have wonderful coaches, orientation, and then help obviously with doing resumes, things like that. But that assistance that anybody that's looking for work is going to need, it's almost full-time work looking for work. So it's important. And we thank Pima Community College for all your great work. We do have a work resource site on our website. So anyone also looking for work can go to aarp.org, and on the menu there is a job board. A part of our website also has our great family caregiver resource site, another amazing website to get all kinds of resources for family caregivers. And we have our popular Movies for Grown-Ups program. Whenever we have a movie, and we just had one this week, as it was mentioned before, our crowds are getting bigger and bigger. Our last crowd, well, our biggest, we can say, is 275 people came to the Loft to watch movies for us. We invite members and non-members. They don't have to be members. In fact, all of our programs really can be accessed by everyone. You do not have to be a member. So with that, I also want to tell you that before you leave, if you pick up our flyer for the Tucson Information Center, Tucson is lucky to have what we call an AARP Information Center. This is where you can come and get any kind of AARP literature, whether you want some for your office, if you'd like for us to come and give presentations. We have volunteers that are available for presentations. And at our information center, we're lucky enough to also do fun events like drumming circles, American-style flute classes, nutrition classes. So we're trying to do a lot more at our local level to bring our community together. The last thing that I'd like to share with you is that AARP has 3 arms, and a lot of times people don't understand how we're organized. The first one is AARP. We are a nonprofit. We are a 501c4. The foundation that I mentioned before, AARP Foundation, is a 501c3, and they deal with a lot of our issues of isolation, hunger, poverty. And then we have our AARP Services Incorporated, which is our profit side of AARP, but they work with all our providers. So when you see AARP United Health, AARP Hartford, that division of AARP takes care of those folks. Thank you.
It's amazing. I am a lifetime member of AARP simply because I work for AARP. That's the advantage of working for it. Right, Steve? But I buy a membership for my parents. And my parents, they do not read in English. And I still buy their membership for them. That's how strong I believe in AARP. And AARP has so much to give. And one of the areas that I value the most is information. We empower people through information. That's exactly what we try to do twice a week through our radio programs. You know, we talk about living trust. We talk about Medicare, Social Security, retirement. We talk about life insurance. You name it. So the issues that AARP addresses on the website, on paper, we bring it to the radio waves and through social media. So it's kind of like one work through different avenues. I would like to introduce now the second or the next item on the agenda. And you know, one of the things that I value so much from working for AARP is understanding healthcare in America. Healthcare is a big, big item, both in terms of the need for healthcare, the concept of healthcare, the budget aspect of healthcare, the political aspect of healthcare. Healthcare is wrapped up with the history of America and the day-to-day of America. I mean, even today, we are hearing a lot about single-payer system, Medicare for all. The Affordable Care Act was a huge attempt to fix some of the issues, and it did some, but there seems to be an interest in revisiting or not, or coming up with different approaches or what have you. But AARP has been in the middle since its beginning, 1958. And I mean, I just learned recently that our founder, Ethel Percy Andrews, was involved with the passage of Medicare. Think about it. Medicare became law in 1965 as part of the Social Security Act, and our founder was already involved with LBJ in conversations, etc. So AARP has been in the middle of this important big items, and a lot of times people put us in the Republican side, and then others will come back and say no, on the Democrat. But we try to address issues. We do not care for political parties. We do not contribute to PACs or anything. We address issues: Social Security, Medicare, healthcare in general, caregiving, you name it. So the subject today for our TED Talk in Espanol, no? You know, the concept, I'm just kind of using the concept. I love the TED Talks, and this is basically my dream of making that kind of caliber type of lunch and learns that people are waiting for the next one to come, because we bring good subjects and good speakers. The subject of our lunch and learn today is healthcare. Stop RX greed. And within the scope of healthcare, a huge item is prescription drugs. And there is a lot to talk about and to address, so I'm not going to get into the content of the presentation, but I'm going to ask we're going to have three speakers that are going to address healthcare, stop the RX greed. And let me say a little something about each one so we don't have to do the introduction after each speaks. Each will have no more than 15 minutes. First, we'll have Lupe Solis. And Lupe Solis is a former employee of AARP. She used to be the Associate State Director for Advocacy. And she is, I mean, I consider her my mentor, because I started with AARP almost as she was kind of leaving. So we got to work together for several years. And I know her. She's involved in a lot of nonprofit volunteering engagements. She's just tireless, caring person for the community, and it's a privilege for me to know Lupe. Our second speaker will be our state president. AARP has a board at the national level and also a council at the state level. And at the state level, I already mentioned that Marty Cortez is an executive council member. So our second speaker will be Dan Martinez. Dan Martinez is the state president of AARP Arizona. And by the way, oh, I am so sorry. That is correct. Don Seymour was recently became, how long ago, Dan? Don? About a year and a half ago, he joined we have several from Tucson actually, huh? At least two, yeah. My apologies, I overlooked that. But yes, Don Seymour is also an executive council member. Coming back to Dan, he's the state president. The presidency, in this sense, is a volunteer position. So again, Dan is a volunteer. He leads the executive council. He's the state president. And one more gentleman that he's all over. He's involved in a lot of good causes as a volunteer. They are just activists, and they get involved in serving the community in an unbelievable way. And last but not least, my colleague Steve Jennings. Steve Jennings is the current Associate State Director for Advocacy. He's the one. Now, you did not took Lupe's jobs, but until later on, right? So there was one or two more before Lupe, or after Lupe, and then you came in. One? Two, right? Yeah, so there were two Associate State Directors who came in, and then after Steve. But Steve goes back, I mean, he's been with AARP for 20 plus years, very knowledgeable in the advocacy arena. So without any more introductions, let me ask Lupe to come to the podium and present or start the presentation. We will use a PowerPoint, so she'll be directing us to go to the next slide. And again, the subject is Healthcare, Stop RX Greed.
Thank you, David. And thank you all for coming today. We're very pleased to have you here. We do have this presentation about prescription drug greed. And we're hoping that you will engage in this because we know that this is an issue close to all of our hearts, whether for ourselves, our children, our grandchildren. But as the campaign progresses, we're hoping to have many, many opportunities to be with you and to speak about it and to disseminate the information because, as you know, it doesn't just take something to fruition to know about it. It takes doing something about it, right? And educating the community. Thank you, David. So these are just a few of the pieces of the puzzle that we are going to touch on. Some background, the political landscape, the impact on our membership and others, our campaign targets, the message framework, and what we're going to do moving forward both in the state and at the federal level, as well as eventually finding some of the solutions. This is not an easy problem, as we all know, right? So we start with the usage of drugs. Let me ask you out there, how many of you take at least one drug a day? How many of you take two? Did you know that the average is 4.5 per person? If you are a Medicare Part D enrollee, that's usually the average of what people are taking, 4.5. And over 2/3 of our seniors have 2 or more concurrent chronic conditions. And why do I mean by that? You might be diabetic, you might have some arthritis, and those are issues that have to be taken. In order to maintain your health, we have to take care of, right? Usually with medication. The cost of medication has gone up significantly, and it's important to know that the median income of a Medicare beneficiary is $26,000 a year. That's not a whole lot of money, right? So, as some background, our country has the highest cost of brand name prescriptions in the world. And I think most of us know it, right? We're not that far away from Mexico that most of us don't know that there are exactly the same prescriptions here, medications that you can go buy in Mexico for a lot less of the cost. So why is that? Well, retail prices for most of these brand name prescriptions by older adults and others have increased by an average of 8.4% in 2017, compared to a general inflation rate of only 2.1%. See the difference? What happened there? So if these retail drug price changes had been limited to the general inflation rate, the average cost of that therapy that I was talking about, costing almost $6,800 in 2017, would have been only $2,178. And by this, we're talking people who really need a medication to sustain their health. So for more than a decade, the average increase of drug prices have been more than twofold and as high as 100-fold. when my colleagues and I were trying to figure what that meant, it means something going from $1 to $2, or something going from $1 to $1,000. And if you think we haven't seen that happen, we have. If any of you are familiar with something called the EpiPen, you know what that is? For people who are extremely allergic, for whom it's a life and death situation having one available. One of my grandsons is in that category. He's only 13 right now, thank God. But when the price of that went from 100 to 300, my daughter panicked. You know, she has to keep one in the house, one in the car, and if I have him with me, I have to keep one around. And then it went to what? Over $700, the cost of the EpiPen. And it was only public outcry that brought the price back down, not to $100 anymore. It's in the $300 to $400 range. Okay, well, the same happens to people who have diabetes, and we keep hearing about that. The crisis, it's a crisis. So if we're wondering why these, can you go on? If we're wondering why the cost has gone so high, it's pretty simple. There is nothing stopping the drug manufacturers from charging these high prices. They are making billions in profits off of us. Other countries have agreements or drive a much harder bargain with drug manufacturers to keep their prices down. But as we all know, in the U.S., demand dictates price, right? There's a demand for something, the price is up there. And so that's exactly what's happened with many of our prescription drugs. And it's true that some of what David was referring to earlier in our conversation has to do with all the advances in science that have come about and in technology, and they have generated wonderful therapies for illnesses for which we had no cure before. Multiple sclerosis, some forms of cancer, diabetes, you know. We have the therapies, but if they are not affordable, they are not accessible, right? And that's what's happened to some of them. I think Dan and I were commenting, or somebody during the break, that some of those therapies could cost $4,000 a month. You know, we have a particular member in our group of advocacy who has to go into the hospital about once every month and a half because she can't afford the price of the prescription, so the doctor actually puts her in the hospital so that it can be covered. You know, and that's the only way she can do it. So they entirely control the supply because they hold what? Patents, right? Patents. That's what gives them the monopoly for the 20-year life length of the patent. During that time, they can raise the price as frequently and as high as they want to, as much as the market will bear. And companies have, the drug manufacturers have become very, very knowledgeable about how to keep these prices up even as the patent is wearing down, okay? They might make a slight change to the medication by which they can call it by something else. Or they might do other practices such as keeping generic drug manufacturers off the market. So the longer they control the monopoly, the longer they can continue to charge whatever they want for their product. And we all know that that's happening, right? I know that my husband, for example, was taking a certain drug that was costing him $40 a month. And it wasn't until about 3-4 months ago that we discovered that was a generic. Guess how much the generic is? $4. Huge difference, right? 40 to 4. So we also know that these companies spend a lot of money. Yes, they do research and development, but they also spend a lot of money on marketing and advertising. Last year, they spent $24 billion marketing to healthcare professionals. Have you been to your doctor's office and seen this very well-dressed lady or beautiful young woman or well-dressed gentleman, with his little suitcase? Guess what they're there for? To convince the doctor that this is the wonder market that he should be prescribing, right? And even though I think that some of those practices have been somewhat curtailed because people have reacted to them, we've all seen the ads on TV, right? The wonder cure that cures just about everything you want, except that if you're really listening to the commercial, at the end of it, they also tell you all the things it could cost. And I guess I could share with you that I am a direct recipient of that. I had not, in all my years of life, I had never been a regular consumer of any prescription drug until late last year. And there was something the doctor wanted to correct, so he gave me a pill. And I thought, oh, one a day, wonderful. And then he said, but I have to give you this so that it doesn't affect your liver, and I have to give you this so that it doesn't affect your heart, and I should probably give you these for this other reason. And all of a sudden, I'm a 4-pill-a-day patient, okay? How it just happened overnight, and it tripled. Well, frankly, quadruple my costs per year, because I used to spend maybe $75 a year buying, something for my arthritis or, occasionally, and all of a sudden it became a real cost of $40 a prescription, plus the fact that the insurance companies like for you to buy a 3-month supply. So instead of $40, it's $120. I happen to be extremely allergic to a lot of things. So the first time I bought the 120 prescription, no more, folks. I could only take it for a week. And now I'm stuck with that because nobody else can use it. I can't return it. So I'm learning, as we all are. In 2017, the drug industry, generally known as pharma, we refer to pharma a lot, spent over $5.5 billion on direct consumer advertising. Those drugs that you see on TV that bring many a person to the doctor saying, why am I not getting this? And we know it happens, right? Including nearly $4.2 billion on television advertising. That's a lot of money, folks, a lot more than they spent on research and development. So to make it worse, Medicare has no authority whatsoever to bring down the price of drugs because as one of the largest purchasers of prescription drugs, Medicare is forbidden by law to negotiate prices. Let me say that again. Medicare is by law forbidden to negotiate prices. In Medicare, when Congress was debating this issue 13 or 14 years ago, right? The drug lobbyists, industry lobbyists, convinced members of Congress that giving Medicare the power to negotiate drug prices would be the equivalent of control, of price control. And you know how averse we are to price control in the U.S., right? So we went right for it. But if you compare Medicare to the Veterans Administration, are any of you veterans here? Don't you know what it's like? It has been, the ability to negotiate prices has demonstrated that they are able to pay 80% less for brand name drugs than what Medicare pays for the same drug. 80%. And this is according to a recent study by Carleton University in Ottawa. So, next slide, David, please. It's become clear that this is not just an issue, it's a crisis, folks. There are people that literally do not take care of basic needs in order to take care of their prescriptions, or vice versa. Forgo the prescription because they can't afford it. So it's become clear that both at the federal and state level, elected officials in both parties understand the urgency of this need. The president has spoken against this high cost, and he has expressed a willingness, if you're listening to his State of the Union, to address the issue. What that will consist of, we don't know yet. But the leadership in both houses of Congress, the House and the Senate, continue to emphasize this will be one of the top items that should be addressed by them. This has become a campaign issue because both Republicans and Democrats are now calling for measures to lower prescription drugs. And rightly so, right? In addition, governors and state legislators and administrators of programs have begun to debate the possible solutions to address the rising cost of prescription drugs. So it is only reasonable to expect that given the urgency of the problem, the political will to act, with our help and push, right? Because everything takes push, that governors and state officials will be eager to, and elected officials will be eager to deliver on their campaign promises. And we're here to make sure they do, right? So, what's our member impact? This is a slide that I'm going to have to look at myself because as I looked at it, I thought, ouch, I don't understand it. So, in preparation for the campaign, AARP conducted a national survey of voters age 60 and older who are likely beneficiaries of or utilize drugs. This survey found that significant majorities of Republicans, Democrats, and independents shared concern about the high price of drugs, and they would support common sense policies to address the problem. The survey included, and you'll see the numbers up there, 72% say that they're very concerned about the cost of their medications. 63% say that the cost of prescription drugs is unreasonable. I wonder why it wasn't the same number, but at any rate, that's what it showed. 90% support allowing Medicare to negotiate to lower drug prices. And 80% report taking at least one prescription medication. We saw it right here in our hand holding, right? So quite a few of us that are taking more than one a day. So nearly 40%, and that's not reflected there, but it might be in the, I can't read that far. I can't read from here to here, truth be known. Nearly 40% say that they did not fill their prescription by their doctor, with cost being the most common reason why they couldn't do it. And that's understandable. That's really understandable. So, success will come when consumers are no longer gouged by the cost of their drugs, and when the industry understands that they can no longer consider this to be a never-ending money fulfilling their pockets, right? This is supposed to be a multi-year campaign effort. It'll start with public education, as we're doing here, and then it will continue with possible solutions in some states. So far, David, would you shift it? So far, we understand two things. Not one solution will take care of the problem. Not one solution will make them more affordable. So therefore, as I said before, we're going to pursue many legislative, regulatory options at the federal level and in a number of individual states to be yet determined. But the strength of AARP is its nationwide reach. We are a nationwide organization. And so, since Congress and the President both say that they want to address the exceedingly high prescription drug prices, we hope and pray and will work to that effect that that the pharmaceutical industry will be forced to offer justifications for the pricing and solutions to lowering their drug prices. And it can be done. It can be done. And it will be done. So, as I said again, it's a multi-year effort. We know that everything takes time. But we're here, and others of us will be here, right? So, thank you, David. The next one. Our elected officials are going to be the focus of this year's effort. The President, members of Congress in both houses, and as I said before, in some governorships and in some state legislatures. This is one of the biggest campaigns that AARP has undertaken, and I've taken part in 3 very big ones when they were trying to privatize Social Security, remember, years ago. Later on with the prescription drug Part D, and I was very much a part of the Affordable Care Act, Obamacare, if you will. But we're targeting all branches of government. A number of states have already engaged in this fight, and they have been successful in increasing awareness and the willingness of elected state officials to consider legislative options. And one of the things that we must consider is what that AARP is able to, you made the promise, now tell us what happened. I don't know how many of you were around when when Mrs. Napolitano became governor, remember? But the day after she became governor, she initiated the RX discount card, and we were called to the table because we had been at her heels the whole time, saying, you promised, you must deliver, and she did. So since interest is so high at all levels of government, this is a prime opportunity to position AARP to be a player at the table on this issue. And we hope that you will join us and that you will, as you listen now to what the strategy will be from my colleague, my esteemed colleague and distinguished state president, we hope that you will not only join us, but tell others about it, because it's in the public community outreach that we will be successful. Okay?
Greetings, everybody. As a retired teacher, I always like to make sure that everybody can hear me. I wear hearing aids, some of you do too, so I want to make sure that the message is coming through. Now, I know talking about drugs is not as sexy as what's going to happen with the University of Arizona basketball coach? Or is our state legislature going to provide enough money for public schools? I came from the public school sector. That's an area that I'm really concerned about. But as David and Lupe have said, prescription drugs is a big part of our life. And I only take one for cholesterol. And I was taking a generic drug for quite a while. And then Crestor, which was a brand name drug, ran out of its patent, 10 years or whatever they're allowed to do. And then it became rosuvastatin. So my doctor said, we need to change you from this drug to this drug. Why don't you try this one? So things happen, things change. Drug companies have a big advantage, though, as we've heard. And so we need to keep them accountable. Now, many people say, and this is our message, our framework. David, we have it up here? Yes. That government is broken. We can believe that if we want. And that drug companies are really gouging seniors and others that need prescription drugs. There's not a whole lot of people that don't have a need for some sort of prescription drug sometime in their life, and sometimes more than one. So let's see if you agree with our messaging here, our campaign core messages. No one should have to choose between food and medicine. How many of you agree with that statement? No one should have to choose That's common sense, right? Well, we're saying that to everybody in this campaign. Number two, Americans shouldn't have to pay the highest prices in the world for their medicines. How many of you agree with that statement? Can we go to Mexico and get some? Are they always safe? Can we go to Canada and get, well, that's a little bit further. But Don, you have some relatives in Canada, don't you? That we can get. This has been mentioned. Number three, it is shameful that drug companies spend billions more on advertising than developing new drugs. I watch some news, some sports, but I can't get away from those drug commercials. Every other commercial is on drugs, and you can't even pronounce the names of these drugs. So how do you go to your doctor and say, I want this drug? You can't, right? Okay. Number four, people of all ages depend on their prescriptions and deserve common sense solutions that lower prescription drug prices. How many of you agree with that statement? So you're with us, right, on all these statements. We've got the right messaging, right, David? And this came out of D.C. We can't take credit for it. So the next slide, David. Our call to action to Congress is, come on, folks. We elected you. Do what's right for the American people. Stop letting drug companies price gouge seniors and hardworking people that need prescription drugs. Pass some legislation that makes sense for all of us, not just a few. That's our message. So that's the stop sign. Do something good for all of us, right? How about the next slide, David? If you want to stay up with what's happening with this campaign, it's real easy. Just go to this website, aarp.org/RX. Simple enough. Because things are going to be developing and changing as we go through the campaign. And as Lupe has said, it's going to be a hard-fought campaign. Big Pharma has a lot of money. They're already engaging their supporters and putting out messages like we are to try to convince people that, no, we need to make a lot more money than the billions that we're already making. Not fair, not fair. Next slide, David. Okay. We have come up with 4 principles of how we're going to do what we want to do, which is to lower prescription drug prices. And very simply put, we want to protect seniors, number one. We want to help people get drugs that they need at fair prices. We want to close loopholes that allow pharma to keep their patents for a long time or to change their medicines a little bit and get a new patent. And we want to know why pharmacies and pharmacy companies are selling the drugs that they do for so much. So there's some ways that we can do that. I'll give you a couple of items on that for each one. If we're going to protect seniors and all taxpayers from price gouging, one of the things that we really should do is allow Medicare to negotiate drug prices. The VA does it, right, Don? Yeah. I think the Indian Health Service does it, right, Steve? And so why not Medicare, which covers more people? They could still make profits off the millions of Americans that are on Medicare, but they don't have to make as much. In helping people, we want the states to be involved and try to limit the out-of-pocket costs that people have. You know, those deductibles, those things that they ask you to pay when you go pick up your prescriptions. We want to try to limit that as we possibly can. Now, closing loopholes. Wow. There is a thing that pharmacy companies do called pay for delay. They pay these other drug companies that make the generic drugs to delay making these drugs available to the rest of us so they can keep selling the brand drugs for more. And that seems to me like it should be illegal, but maybe we can pass some legislation that will take care of that. And as far as transparency, we just need to know why certain prescriptions cost what they do. There's no rhyme or reason for paying $4 for one medication and $40 for another and $400 for another one that treat the same kinds of things. It just doesn't make sense. Okay, David, one more slide there. We need help in amplifying this message. We can come up with really good messages from national AARP in DC, but we need you folks to help us carry the message out to the folks out in the communities. We can't do it by ourselves. Now, in state advocacy, we have people like Steve, and we hire lobbyists to help us deal with the legislature and the governor, and we will continue to do that. It's effective in certain respects. So please know that AARP deals with the legislature and the governor on issues like this. We'll continue to do that. Now, the third item up there, when I first heard the word influencers, I thought we were talking about the flu. I know what the word influence is. I teach reading, I'm a retired reading teacher, but when I saw influencers, I thought, who are those people? What do they do? Well, it's people that can get people to take action, right? They don't necessarily have to be rich and powerful or legislators, but somehow they have connections in the community and they can get people to take action. So we need to work with those people. Grassroots advocates, people like ourselves that are interested in certain topics and we want to take action on them, that's important. And then AARP has members that we want to engage. You are engaged now. You're part of this campaign now, whether you like it or not, because you know more than most people out there do, right? And then this, to me, is very important, the storyteller part of it, because I come from the teaching arena. A story told well gets the message across a lot better than a lot of text. So I heard some of you talk about the prescription drugs that you take. Yeah, that's a story. So if you know some folks that can tell their stories about how they've dealt with prescriptions, get them to talk to David Parra because he can videotape them and put them on Facebook and YouTube, right, David? Yeah. So, for example, my wife is diabetic. She's been taking medications for that for 20 years. She also had a mild stroke back in 2014. So they put her on some high blood pressure medicine. And she's had difficulty finding the right medications for her diabetic condition. So it's a hassle that you have to put up with. And these drug companies, they don't care. They just want to get the money into their pockets. So those stories are really important. Steve would probably be a good person to tell his story about his medications because I hear he takes, what, a dozen, Steve, or something? Only 4. See, that's still quite a bit. So those are stories that we need to tell. One more slide, David, and we'll get done. Now, we have work ahead of us, all of us. And one of the things that we need to do is to continue to identify these storytellers out there. I know Marty knows a lot of people in Tucson. You can find some folks that will tell you, here's what I've experienced with my medications, okay? We mentioned item number 2, to deliver our message to elected officials. We just had a AARP day at the legislature on Tuesday. We fed the legislators. Some from Tucson showed up, and we got a chance to talk to them about what's important for us, like caregiving and money for caregivers. That was our central message this time around, because we've got a bill in the legislature that we want funded to try to help caregivers that are taking care of loved ones at home that need some help to cover some of their expenses. We do that. Number 3, all of you can stay up to date easily. All of you can type www.aarp.org/RX. That'll get you the latest information on this campaign. How many of you use Twitter? How about Facebook? I know David's been going on and on and on about Facebook. How many of you use Facebook? See, David, if this is an indication of our population that we're trying to reach, we've got to use multiple ways of trying to reach our folks, right? The 60 or 50 plus or 65. I just wanted to make sure that we did that because there's different ways of reaching out to people. Anyhow, that's the gist of my message. Steve is going to wrap it up with the political side, and we will take questions afterwards, right, David? Okay, thank you very much.
Steve Jennings. Do you remember, you might be, many of you might be too young, but remember the early days of Saturday Night Live had the great comic Gilda Radner, who's passed on now. And she always did this poem I always liked. Doctors are whippersnappers. Doctors are whippersnappers in iron white coats who spy up your rectums and look down your throats. They press you and poke you with sterilized tools and stab at solutions to pacify fools. I used to revere them and do what they said until I learned what they learned on was already dead. So, yeah, you're hearing about this Stop RX Greed. That's there's got this other part of the name, cut drug prices now. And, you know, here's my testimonial. Mine are $120 a month. I got 2 brand names, which are this is with AARP's great insurance plan, $50 co-payments. And then the 2 generics have $10 co-payments. So I'm not really complaining. I know my mom there at the end she was taking 12, Dan. And you know, part of it was she would refuse to take the pills, and then, you know, I'm sick of taking the pills, I'll just go ahead and die, and then we'd make her take them. So, and you know, this is a problem you know, we're all having, and that's the power of this campaign. There's a bunch of national groups associated with it at this point. You know, the president bringing it up in the State of the Union address. AARP put over 40,000 emails into him asking him to do that. The Congress people are well aware of it. We met with Martha McSally on Monday, and she was telling us her 84-year-old mother is visiting and taking a number of prescriptions, and that she's well aware of, you know, the costs of that to the family. And it's ridiculous, you know, we don't need to pay the highest prices in the world because we're the only country that doesn't put pressure on the manufacturers to hold the prices down. And this is going to be a multi-year fight for AARP. We're not going to give up until we see some progress in it. And you already saw that we're going to conduct it on the state level and on the federal level at the same time. Did you all get this handout yet? This is our one-pager on the campaign, and it's our asks. This is what we want. And it has some bill numbers on the bottom that are a couple of the main things. Okay, so here's our federal asks are up here, okay? And there are 3 things. Lower prescription drug prices through secretarial negotiation. That's this first one, reduce RX prices, increasing competition. You know, these drug companies, they get the patent, right? They're monopolies. They're the only people you can get this drug from. And they really are miraculous drugs, right? They keep us alive. I mean, it's a wonderful thing. They're part of the lengthening lifespan, but there's no competition. And that, you know, we know in our system that's what makes things affordable. So how can you increase competition and reduce out-of-pocket costs? On the secretarial negotiation, the very first thing, reduce RX prices. The federal government of the United States is the largest buyer of prescription drugs in the world. Now, you know, I was at a aging conference, and at our table next to us was United Healthcare. So I was talking to these guys that work for them, and this guy tells me that they insure 40% of the people in the United States that get private insurance. And if you have that many, if your buying pool is that large, you just go to these, you know, big drug companies and you have a lot of power over whether you're going to purchase their drug and what you're going to pay for it. Well, the federal government, you know, through Medicare Part D, buys a lot more drugs than United Healthcare, so it should have tremendous power to hold down the cost. So we want the government to do that. We want the government to use its purchasing power to lower drug prices, or at least stop them from going up so rapidly. You heard that in 2017 they went up 8% when the inflation rate was 2.1%. What's that about? Okay, so the way you can increase competition is you bring generic drugs to market faster. I had my pharmacist call me up the other day, CVS on 50 West Jefferson there in Phoenix, and say that there's now a generic for one of my drugs, and do I want to take that? And I had to, you know, contacted the doctor. The doctor said it was okay. It'd be the same thing. And so I was able to save some money that way. Well, that should be available more quickly. Dan talked about how these big manufacturers are actually giving money to the generic companies to not bring their generics forward so quickly. Or they do another trick, Lupe brought this up, they make a minor change in the brand name drug, and then the generics have to start over to duplicate it. Both of those things should be illegal if they're done with that intention of just keeping us from getting the generics sooner. So AARP, these two bills on the bottom of that sheet are about those two things. The CREATES Act, which is that 965-340, will close a loophole that's allowed brand name drug companies to use unscrupulous tactics to keep lower cost generics from entering the market. And that 1499 would ban drug companies from being able to pay a generic drug company to hold off bringing generic drugs to the market for a period of time. Those are our federal approaches. Next slide, David, please. These are our state approaches. State importation, Florida's working on this right now. States could combine together and bring drugs in and make them available through the regular, means they do, through the pharmacy, CVS and Walgreens and all that. That's one way that they could use combined purchasing power to get lower prices. The pharma has started campaigns in a number of states to oppose these changes. And what they're doing is they're telling you that you won't get safe drugs if you bring them in from out of the country. Already, the Food and Drug Administration, under emergency procedures, has brought drugs in from other countries to make sure there were enough in the country to meet the need. It can be done safely. Canada has 30-some drug manufacturers that are all meet U.S. standards to bring drugs in. So don't believe it when you're told that, there are horror stories of people that have gone on unknown websites and purchased drugs that did not turn out to be what they were told they were. But when governments do it on a large scale, it can be done safely. Number 3, these price gouging laws that would require drug manufacturers not only to report on their prices, but also provide justification for certain levels of price increases. Lupe brought up the EpiPen and what we all saw happen there. When there are large-scale increases in prices, those should be reported publicly and the reasons for them. And state attorney generals should have authority to levy penalties if they don't do that correctly. Finally, the setting out-of-pocket caps. I mean, at what level should people be, get a break from their costs going up? Should it be $100 a week, which would be $5,200 a year? That's 10% of people on Medicare are paying that much for drugs. There's one person here in the room I was talking to that is taking a drug that's $4,000 a month. So, this is serious business. The caboose is coming by. The arm is about to swing up. You're going to be able to cross the tracks and quit listening. So I'm going to turn it back over to David here, and we'll end it up.
Thank you so much, Lupe, Dan, and Steve. What a wonderful presentation. Great information. Please, let's give them one more round of applause. And keep in mind that AARP.org/RX is the place to go online to get more information. We will devote now a few minutes for Q&A. Now let me introduce Marty Cortez. She'll be taking care of the last item on the agenda, and that is a survey. Thank you, Marty. This concludes our first Lunch and Learn in Tucson, Arizona. This is a seed. We have planted it, and we'll just continue to water it and continue to increase the awareness of this type of events among the community. So thank you so very much to all the attendees, volunteers, everybody. Thank you very much for joining us for the first one. Thank you very much. This is the conclusion of our first Lunch and Learn.